Let's talk thrombolytics. Now, it's very important to remember the mechanism of action of this drug class, okay? So, as opposed to antiplatelets and anticoagulants, thrombolytics dissolve existing clots, okay? So, if you have a clot in your body, you give a thrombolytic to dissolve that clot, okay? They're clot busters. Now, you can group this class of medications through their suffix, and that suffix is ACE, A-S-E. So examples are Alteplase, which is TPA, Alteplase, and Streptokinase. Now let's look over here at the indications of when you would administer a thrombolytic, okay? The acronym I would like to use is PAID. So this is pulmonary embolism, acute MI, myocardial infarction, ischemic stroke, so that's with an emboli, and DVT, okay? Very important for NCLEX is you must administer within 4 to 6 hours of symptom onset. Now remember, this isn't when they showed up to the hospital. This is when a family member or the patient themselves noticed that something was going on at home. Now let's talk about some nursing considerations and education that you need to practice safely as a registered nurse and to pass your NCLEX. So prior to administering this thrombolytic, you need to make sure that you verify all these things. Does this patient have an intracranial hemorrhage? So for example, if they're having a stroke, is it an ischemic stroke or a hemorrhagic stroke? If it's a hemorrhagic stroke, we thin the blood more, they're gonna bleed more, that's contraindicated. Does the patient have an active internal bleeding? For example, like a peptic ulcer, okay? If they have an ulcer in their stomach, is it actively bleeding? Because that is contraindication. Next, does the patient or has the patient had recent trauma or surgery within the past 2 weeks? This is important to ask because if they have, it's contraindicated because it increases their risk for bleeding. Next, you're going to take a set of vitals and make sure that that blood pressure is under 180 over 110. Uncontrolled hypertension is contraindicated in thrombolytics, okay? And lastly, we need to make sure that there's no concurrent use of anticoagulants or antiplatelets. Now, sometimes I see questions asked about how are you going to educate this patient after administering a thrombolytic. You need to make sure that that patient understands that they are going to be going home on anticoagulation therapy to prevent recurrence. Now, anticoagulation therapy is not Alteplase, Alteplase, or Streptokinase, okay, these medications here. Anticoagulation therapy is warfarin, heparin, and other medications that I can cover at a different time. I hope you learned something from today. I also just recently published my Nurse Jess community on Facebook. Check it out in the link in my stand store if you'd like to join.